Let me share my screen. Can everyone hear me? Okay,
Yes.
great. Okay, great. So my project was focusing on COVID-19 mitigations at the university level. And so I'm going to be providing a research overview today about what I did, and then also presenting some of the initial key findings from the research. So in terms of the research overview, WeHealth was targeting universities as potential customers. And so the goal of the research was to understand the experience of university staff that are responsible for developing and implementing COVID-19 mitigation strategies on campus, and then also to help identify key challenges, needs, and the key stakeholders in that process. And this research could help inform the strategy that would be used to target universities, and then also identify opportunities for WeHealth. So in terms of the objectives, these were the three main objectives. So to understand the motivations of universities in their COVID-19 response and the current strategies that they're using, and then also to identify key decision makers on university campuses that can be targeted during outreach. And then finally, to understand the different barriers that universities face when they're implementing these strategies. So this was the research approach. So I did some secondary research to identify any research that had been previously done on the topic, and then to also understand the existing mitigation strategies that were present on university campuses. And these findings helped inform the interview questions. And then also I conducted in-depth one-on-one interviews with 4 participants that were university faculty and staff. So these interviews were semi-structured and they were conducted via Zoom. Each interview was about 35 minutes long. And then I also had 2 additional informal interviews during recruitment as I was calling people. 2 people were willing to share their experience. And so those 2 interviews also helped inform some of the findings as well. And these were the main interview participants. So I talked to the director of health promotion, a safety officer and emergency manager, the assistant vice chancellor of wellness and inclusion, and then also the assistant vice chancellor of university relations. And so now I'm going to share some of the findings and insights that I gathered from the interviews and research that I did. These are just an overview of the key findings, so I'm going to go in depth about each one. But I'll start with the first one, which was that the well-being of faculty and staff is a current concern. In multiple of the interviews that I did, they mentioned that they were concerned about the well-being of faculty and staff. And there were 2 groups in particular that were mentioned, those that were at high risk of contracting COVID-19, and then those with younger children who cannot be immunized, or with family members who are at a high risk. And then at 2 of the universities that the interviewees were from, faculty isn't informed if a student in their classroom is tested positive, which I thought was really interesting. So it really helped illuminate why there is some concern. They mentioned that sometimes they will let faculty know if there is probable contact, but aside from that, they don't usually go out of the way to inform them. And so that really highlighted why there is some concern there. And then this is a quote from one of the interviewees that mentioned that many students feel like because they're young, if they get it, they'll be fine. But faculty who's interacting with students and some who are vulnerable is what concerns this interviewee. And then the second insight was that COVID-19 mitigation is a priority. In 3 of the 4 interviewees that I talked to, that was a major, if not the main priority in their role. And these are 2 quotes from interviews when I asked them, how has COVID impacted your role? So one said that COVID has completely taken over their work. And then the other said that it's flipped their role upside down, and a lot of work that they were doing previously has been put on hold. And then the third insight was that the communications department is a key stakeholder in the implementation process for these strategies. So a large part of the response was just making sure that faculty, staff, and students have access to the information that they need about the different strategies and procedures on campus related to COVID. And so they mentioned that communications and marketing was a really important part of this process. There was also concern about information overload and fatigue. So people are just kind of missing important information about COVID, about campus policies and procedures related to that. So that's why it's really important that they have a targeted strategy when it comes to letting people know about the different procedures on campus related to that. And this was a quote from one of the interviewees related to this insight. And then the fourth finding was around the at-home testing kits. So the one that was mentioned was the Binax Now, but in general, at-home testing kits are impacting the contact tracing efforts on campus because individuals who use them are less likely to report their results to the university or the health department. And then also because they're not, because they don't receive steps on how to report it after they receive their result, it's also difficult. And this also impacts the ability of staff to inform, students or even faculty about next steps. So that can include information about isolation or quarantine measures, but also just resources on campus and different support that they can receive if they've tested positive. And this was another quote from an interviewee who mentioned this. And so they said the challenge now is a lot of people are doing the at-home tests. So they're not talking to nurse, they have no idea of anything. And the health department also doesn't get those reports. So sometimes if someone tests positive at home and they let the university know, they have to inform the health department as well. And then overall, there was just a focus on getting as many individuals on campus vaccinated. So in the interviews, they mentioned that they're focusing a lot of their efforts on encouraging students to get vaccinated if they haven't already. This is specifically in campuses where mandates are not possible. So they have campaigns, vaccination campaigns, and they also have vaccination incentives. And so while the other strategies are still in place when it comes to social distancing and masking, they're not as stringent or emphasized. And then this was my final finding around the case investigation process. So although the individuals from the universities that I talked to mentioned that their Department of Public Health is responsible for contact tracing, but they have in two of the interviews, they mentioned having a case investigation process, which is similar to contact tracing, but not exactly. It typically happens before. And so this is one of the case investigation processes that was described by an interviewee. And I thought was really interesting the process that they go through and the information that they collect and how they communicate with faculty and staff when someone tests positive. So the first step is that they collect information on the date and location of testing, the different symptoms, the onset of symptoms, the living situation of the case. They also ask for a list of their classes, the characteristic of their classes. So were they within 6 feet of individuals, and then places they visited on campus. And then the next step is they'll provide information on what to do. So they'll provide a projected release date from isolation, the different resources on campus, including counseling services and health services. And then if it's a faculty or staff member, they'll talk about COVID-19 leave or workers' compensation. And then they'll notify different faculty and staff members and departments on campus. So if it's a student, they'll notify the dean of their major, but they'll also notify facilities management if they need to clean a room, campus living if the student lives on campus, athletics, the library, and other faculty members, depending on the scenario and if it's necessary. And then finally, one really interesting insight is that they communicate secondary instructions to faculty on how to proceed depending on the case. So if a student is in the classroom of a professor, they'll inform them about that, but they'll also provide templates, one for probable close contact and one for possible close contact, that the faculty can then share with the students in their classroom. And those templates include information about what to do if you're vaccinated, and different, if you need to isolate, et cetera, or quarantine. So it's really interesting that there's this secondary communication, they provide these secondary instructions to the faculty and provide the language for that as well. And so these are some of the personas that I'm developing just based on the insights and the interviews. So the first is, and these are key stakeholders in the process. So the first is the president and chancellor, and they approve and direct all policies, objectives, and initiatives for the institution. And some of the obstacles that they face include juggling different interests and perspectives when it comes to decision making, especially in states where the legislatures banning mandates. And then the second persona is Monica, the vice president of university communications. And so they're responsible for producing news and information resources for the university. And obstacles they face include the evolving information. So things are continuously changing. And then also difficulty with centralized messaging and transparency. And then finally, the third persona is the director of health and wellness. And they oversee health promotion and educational outreach. And so they also oversee the student health services on campus. And the obstacle they face is understaffing and having to juggle a lot of different roles and responsibilities, especially with COVID on campus. So that's just a brief overview of some of the findings and some of the insights that I'm developing. And this is the PowerPoint version, but I'm also developing a report that will have more detailed information, including recommendations and next steps. So yeah, that's my presentation. Thank you, everyone.